Hi, I'm Dr. Vivien Chan. I'm a pediatric spinal neurosurgeon at Alberta Children's Hospital in Calgary, Alberta. I'm speaking to you about my JBJS article, Pediatric Spine Frailty Index Predicts Postoperative Morbidity and Mortality in Spinal Deformity Surgery. So we often see quite a bit of variability in outcomes after pediatric spinal deformity surgery. Some patients do really well and go home postoperative day 1 or 2, while others, often those with more complex medical backgrounds, can have extended length of stay and serious complications. In adult spine surgery, frailty has emerged as an important predictor of surgical risk. But in pediatric spine surgery, frailty hasn't really been studied. This gap motivated us to ask, can we create a frailty index for pediatric patients undergoing spinal deformity surgery? And can this frailty index actually predict which patients are at higher risk? In our study, we included 34,000 patients to create the Pediatric Spine Frailty Index. We included 6 significant comorbidities, which were severe respiratory disease, gastrointestinal disease, seizure disorder, asthma, cognitive or developmental delay, and neuromuscular disorder. And what we found was that this frailty index was predictive of any complications, severe complications, extended length of stay, and even mortality. I think the biggest takeaway from this article is that not all comorbidities carry the same weight. And when we add significant comorbidities together, we can stratify risk in a meaningful way. The Frailty Index gives us a simple tool to capture this risk before surgery. For example, a patient with severe respiratory disease and seizure disorder is not starting at the same point as an otherwise healthy child. Surgeons, anesthesiologists, and care teams can use this Frailty Index during preoperative planning to guide patient discussions, anticipate complications, and potentially optimize care pathways based on the frailty score. A key unanswered question is how frailty impacts long-term outcomes beyond the 30-day window. In our study, we focused on short-term morbidity and mortality. The patients and their families care about function, recovery, and quality of life months and years down the road. Another unanswered question is whether or not frailty is modifiable. Are there rehabilitation programs or ways to medically optimize these patients to reduce their risk before surgery? Going forward, I'd like to see prospective studies looking at long-term outcomes over time and studies looking at preoperative interventions to see if we can improve outcomes, not just predict them. Thanks so much for listening.